voilà, quand nous rejoignons dans le topic conversation, aujourd'hui, bon matin, pareil, moi, dit bon matin, et conversation qui nous pour continuer, et qui nous déjà commencé, bien sûr, avec le docteur Gupta qui nous a aujourd'hui, bon matin, nous continuons sa conversation que nous avons fait. Dernière fois, on connaît sur rappel, nous avons un petit peu l'arthritis, et aussi l'orthopédique, que le docteur tient un petit modèle qui montre nous. Alors, nous partons fini sa conversation, il y a quelque chose encore pour expliquer. Alors, voilà, quand nous faisons aujourd'hui, bon matin, docteur Gupta, good morning.
Good morning, ma'am.
Welcome back.
Thank you.
I'm good for a Tuesday. Yourself?
Yes, I'm pretty good. Feeling nice.
Feeling nice?
Yes.
With some rain?
Yeah, like this amount of rain because it was a little humid when I landed because I came from Delhi. So there it was pretty cold right now, and here it was pretty hot. But with the rains, it is now good.
It's good. Docteur, quand un petit peu nous conditions l'état en ce moment-là, bien sûr. Alors, ça nous continue la conversation pour la bon matin. Last time you were there, we were talking about arthritis and also a little bit of orthopedic, and we have to stop because time was not in our favor.
Yes,
Let's continue our conversation where we stopped.
So last time when we had a pretty engaging conversation in terms of what is arthritis, what are the most common orthopedic problems that we usually encounter, and how do we treat them, what are the new techniques. So we can sort of take that forward because even after we had left and after this program, we got a lot of queries at the clinic.
Really?
With the patients actually looking for an appointment, trying to know about their conditions. And see, the patients are actually patients. They don't actually know what they are usually suffering from. If they have any joint pain, if it is more in the morning, or if it is just simple walking pain that they start feeling, everything for them is arthritis, which by definition is also like arthrositis, joints inflammation, that's it. So that's how you actually define arthritis. But going forwards, there are different types. There are some which is the most common, which is age related. So this is the wear and tear which happens into the joints of our body, which is called degenerative arthritis, most commonly seen in the hips or the knees, and the third most common site is the spine, the colovertebral. As far as the other arthritis is concerned, it is like rheumatoid or autoimmune. Our own body is actually producing some antigens, antibodies against our own joint linings. So that is an autoimmune arthritis, tends to happen more in the morning times, usually starts with the smaller joints like the hands, the feet.
Like freezing.
Yes, freezing, they become stiff, you're not able to move it that well. But if it is consistent, going on for some time, then you actually know that you are actually having a autoimmune arthritis, and the treatment for both degenerative or autoimmune is completely different. It is very important that you recognize your symptoms, meet your orthopedic surgeon or your rheumatologist and get this sorted out, because if a degenerative or the wear and tear requires exercises and activity modifications with a little bit of drugs, but with the autoimmune arthritis you need to control it with good drugs, because otherwise it can actually lead to dislocation or disfigurement of your fingers, your toes. It can lead to disfigurement of your knee joints, they become bow or knock knees.
Must be the right dose at the right time.
Absolutely, at the same time it should be early diagnosed so that you do not actually carry it forwards, you do not make it more aggressive. And the third thing that usually seen with autoimmune arthritis is that you tend to have a hereditary trend to it. So if somebody in your family, your mother, your father, somebody has had it, then you can actually also pass it on to the offspring, and you might have also got that gene for it to express. But it's not totally hereditary. Many people actually acquire it new in the families. So any of this, but you need to have the right diagnosis before going forward. So always meet up with your doctors or the specialists, the generalists. They are able to find out the causes and then start with the adequate treatment.
Bon, dis-moi de la cour pour qui peut regarder nous là bon matin tout le temps on dit pour un petit temps pour nous visiter nous l'école de temps en temps aucune abnormalité qui partit là ou dit ben ça comme si mon papa peut ça bonne quelque chose. Alors ça tente pour nous on consulter un docteur spécialisé dans ça bonne quelque chose. Know your symptoms, par le docteur dit tout le temps qu'on nous bonne signes et symptômes, quelque chose qui est abnormal, ça veut dire pas de vrai là, il partit là ou devrait être capable de contacter un docteur, consulter un docteur au plus vite possible, plus bonheur qui possible, better safe than sorry. Tout le temps on dit ça, better safe than sorry. au plus tôt possible, consulter un docteur et justement, docteur Gupta, il a côté Victoria Health Clinic, bien sûr, en étoile, ou capable de consulter nous peut cause, bien sûr, pareil, dernière fois, l'inflammation, dans nous besoin, pareil, nous dit, quelque chose comme ça, arthritis, nous avons une définition arthritis, c'est qu'on l'inflammation avec besoin, quelque chose que tu senti, docteur Gupta, il a pour ça, il côté Victoria Health Clinic, bien sûr, là-bas, en étoile, call ou bien walk-in pour des appointements, pour demander pour voir docteur Gupta, bien sûr, pour guetter qui a un problème, qui a surtout la bande l'état décembre, comme si pas l'état pour nous malade là, contactez docteur bonheur, guetter qui problème, et ou un médicament, et pareil, nous dit, médicament qui gagne donné est nécessaire, très important, qui vous prend lui à l'air and the right dose, bien sûr, pour capable continuer à cause capable faire du mal si vous ne pouvez pas the right dose, or if you don't take it at all. Just leave it there.
If you leave it there, it's going to become very, very aggressive at a very young age. It's going to make you crippled in most of the activities that you need to do. You can wake up daily with a lot of pain. It's going to take you about a couple of hours for you to start becoming normal, do your daily routine. Then again, by the evening or when it becomes a little cold, your joints are going to become stiff because the linings are swollen. Difficult for you to grab things, hold things, do finer things because the joints are damaged. So it should not be left that late. You should actually, and there are many people in many countries who have alternative treatments beyond the actual medicine treatment which we have. If that is helping you, continue with it. But if it is not, don't persist with it for too long.
Report.
Yes, absolutely.
There might be changes in the medication?
Yes, because if these are autoimmune conditions, so everybody's body is going to react differently. So you cannot take it very, very lightly. The dose, moderation, titration takes a little bit of a time for it to get adjusted to the body, and then you get better.
Better and better, graduellement, appareil nous dit petit à petit, ou pas pour lever aujourd'hui, ou dit pour bien, parce qu'on est maladie était, graduellement, doucement, ou pour bien, mais seulement at the right time, at the right dose, considérer pour dire pour bien. Si vous manquez aussi, là, pas faire du tout, et si on a des gens qui disent pas médicaments, nous connaissons bien ça, on est en train de penser à médicaments, nous faut là-bas, à cause de nous miser pour nous pas faire ça. Dispose de médicaments à l'air, et ça là, il y avait masse bien. Some people early this morning, we've got some question. They were asking, what about alcohol and arthritis?
If you have autoimmune arthritis, in many conditions, it has been seen that alcohol tends to increase the stiffness in the joints. The next morning or a few hours later, it tends to happen. But as far as degenerative arthritis is concerned, it does not affect it too much because that's a wear and tear mechanism. So that does not involve too much of aggressive damage if you are having alcohol. So it's not that way.
Do you recommend to take or not to take?
Obviously, it should not be taken in anything in beyond moderation. Anything is not good.
Beyond moderation.
Yes. So even fun is not good beyond moderation. Neither sorrow. So everything should be balanced.
Like for Christmas, that's a little.
Yeah, just for Christmas, it's allowed by the end of the year.
Okay, it's allowed. Pas comme si exagéré, à cause nous dit pour nous, on peut demander pour nous, pas exagérer là. Pour un petit guide, la moitié des verres, half of our glass, it's enough, just for Christmas.
True.
Go ahead and go green light. La moitié des verres, s'il vous plaît, pas plus que ça. Alors, pas plus que ça pour un de Mazou. We have a question which is in Creole, all the way from our islands of Pralais. She said, bonjour Carol, est-ce qu'il y a un pilide pour les os et vitamines, est-ce qu'il bon, si pour les os? She's asking about the bones, the vitamins, and the tablets for the bones. Is it acceptable?
So I'll tell you. Male and female bodies react differently. In a female body, around menopause or beyond, you tend to lose a lot of hormonal imbalances. So because of that, there is an exaggerated thinning or weakening of the bones. So in that case, definitely you should be having a little bit of a higher calcium intake, which can be by the way of nutrients or with the medications, which can be had over the counter, the calcium medications, to improve your bone strength in general, and high protein diet, because both of them are the building blocks for your bones. So you need the calcium, which can act as the brick, and you can have the cement, which is the protein, which actually binds it together and keeps the bones and the muscles strong and actively going. So beyond a particular age, for females it is definitely required. For males, if they are weak, they have diabetes or some other condition which is leading to this weakening of the muscles and the bones, then they should also be consuming it. As far as vitamins are concerned, it's a very, very important component which should be there in our diet. But most of the Seychellois diet consists of a lot of seafood and stuff which has good amount of vitamin D, and plus exposure to sunlight also helps. Vitamin D is typically associated with bone diseases because vitamin D helps in absorption of calcium, phosphate and all that from your diet. So, even if you are having good diet but you are deficient in vitamin D, you are going to have again a bone issue. So, vitamin D, if you are not eating well or you do not like too much of non-vegetarian food, in those cases you definitely need to have about 2000 international units per day. You can have any.
How many units?
2000 international units, just a small tablet, or you can have about 50 to 60,000 international units per month. So, there are these combinations which are available over the counter, and you can have them on a regular basis to maintain your vitamin D levels.
And those vitamins and calcium, you can take it every day.
Yes, absolutely.
Voilà, Mary, la réponse pour question all the way from Pralin. La réponse pour question, yes, it's good. Plus, the calcium et aussi vitamin D fait si qui tous les jours vous pouvez prendre un peu. Oui, et bon, pour les autres. Okay, more questions from our viewers. Doctor, good morning. Is smoking smoking can be a factor? Smoking.
Absolutely, it's a very, very dangerous factor because it leads to decreased blood supply. The small vessels going to the joints or the spine, the colovertebral, the discs, they become thin, and if they start becoming clogged, you gradually tend to have exaggerated bone and joint diseases. It always is associated with smoking. So, make sure that that is something which is not recommended even if you are celebrating Christmas.
Nor moderation.
No moderation.
Not recommendable at all. It's a big cross.
From orthopedic point of view, big cross.
A big one. Dr. Marie-Céline, doctor do a big cross. Take it from the doctor. It's a big cross. Non, non, non. Pas ni recommandable, pas ni nécessaire pour servir. Il pas important. Alors, c'est un big cross. Mettez un petit guine là-bas avec l'alcool. Peut-être modération, mais seulement cigarette. Non, fumer. Non, avec si tout peut gagner bon problème les os, bien sûr, qui concerne ça. Okay, this one, she remembers what last time you came with the model. Yes, the model is here again today. If doctor can show us the first symptom of our back, because I have back pains.
So, more than 90% of the back pains are usually self-limiting. We all have had it in our life. It is just a spasm, just a pull in the muscle. We were bending wrongly, we bent down and we lifted something in a wrong posture, it just gets pulled. So, those are muscle spasms, and they tend to improve with a period of a week to 10 days. With rest, stretches, a little bit of exercises, it improves. But in the rest 10%, there is something which is usually called as a disc problem. So, in between the bones, here in between the bones, there is this disc. So, this disc acts as a shock absorber which the God has given us to keep the
it's the way our
spine,
body has designed. Huh?
Yes, so that the body is flexible, we can bend, we can. If this was all bone, we would not have been able to bend and do everything. So, these discs are the ones which can actually come out, prolapse, causing compression on this nerve going into the leg, causing sciatic. So, till the time the pain is limited to the back, most of it is usually muscular. The second common cause is probably a central disc, which is a small one. The third could be the arthritis of the joints of the spine, as we discussed in the first part. So, if these joints are arthrosed or arthritic, even then you can have back pain only. These are the causes for back pain. But the most common problem that we usually get that we need to treat is this nerve getting pressed by these discs going into the leg. In those cases, if it is a large fragment, we are able to remove it with an endoscope. We don't need to do an open surgery, which has been done till now. We have been able to do 2 cases also at Victoria, wherein we have put in a small laser into the disc and we have shrunk the disc, which was causing compression on the nerve. In the other case, we did endoscopic removal of the fragment which was causing the compression, and both patients go home on the next day.
How are the patients now?
Absolutely normal.
Normal. Voilà, des exemples, docteur Indy, c'est une des affaires bien sûr avec les heures, tous les patients, et bien merci, pareil, nous dit alors aussi que dans doute, pas hésiter pour voir docteur Gupta, Victoria Health Clinic, bien sûr, il s'en doit pour aller comme docteur, il a quand quelque chose par nous expliquer, s'il vous plaît, passez voir docteur. Pas espère dernière, pas espère, moi pas connais moi. On a dit qui pas parce que le docteur dit que c'est scandale, nous mi par nous dit, là nous pas capable tenir encore, il concerne l'ambulance, oui. Alors on nous arrive ça système, on a un petit peu bonheur, vous détectez. And when it's detected earlier, it's the best solution. You
Always
have
the
best
best,
solution.
because in the early stages when the disc is just bulging or something, you can actually balance it with exercises, stretching and activity modification. Most people tend to sit for long hours in the offices, at work. That's not a good practice. It leads to stiffness in the muscles. So it's always better idea to move around every 30 to 40 minutes, take a break for 2 minutes, come back and sit, do a little bit of stretches towards the side, towards the front, make the back a little bit more flexible. Those are things that you should be doing on a regular basis to keep your back healthy.
Healthy. Or otherwise, challenge those bones, challenge. Então, eu ganho um petit lá, nous commençons à fazer, nous pouvons faire un petit peu monopause, l'autre. Même chez aussi, this challenge, nous comme petit stretch those backs un petit peu, les os comme si faire si, tout quelque chose. Tous les bons matins, on dit faire si nous fonctionnons tous les bons matins. Et docteur, we have more questions coming. Bonjour Carole, bonjour docteur. Carole demande docteur s'il y a un traitement pour degeneration arthritis, les ou ban les os ils dégénérés et ça fait ça dit mon souffre. So I'll translate this for you. She's asking about when you have degeneration arthritis, when those bones is degenerated and at times it can be there's pain. Why?
Because the fresh surfaces of the bones which are covered by cartilage have now become uncovered. And those they tend to rub with each other where the nerves are there, and that causes pain. So it all depends on the staging. So if it's an early stage, only exercises to strengthen the muscles around the joints helps. If it is a middle stage, then sometimes giving an injection of a gel or viscosupplementation inside the joint makes a layer, avoiding any bone to bone contact. But if it is advanced, then you need to change the surface by doing what we call as a joint replacement. And we are happy to share that yesterday we did our first computer navigation assisted knee replacement at Victoria in Seychelles. Yes.
Yesterday?
Yes.
Really?
Yeah. And the patient is doing fine. We are happy to share that because
this is good
till
news.
today's time, all Seychelles was used to travel outside the country, or they were getting it done at the hospital.
Yes.
In the hospital, we know that there is long waiting lists. So if people are actually suffering with pain, they have a lot of disability to walk and move, they can always contact us. The patient, we have the newest technique, as we discussed last time, that we will be bringing it to Seychelles, and that's what we have brought in. So we have done the computer navigation knee replacement yesterday with a minimal cut, 1 hour 30 minutes, whole thing was completed.
Only 1
yes,
hour 30
yes,
minutes?
yes, and the patient is doing good. So we hope that we are able to make a difference in many more Seychelles people, because that's what is required. The world is moving pretty fast, and we wanted to bring it. We wanted to bring it to this country as well. So beautiful people, beautiful country. They should have the best of medical services.
Yes.
In the same endeavor, as we promised last time, we would be coming in with an MRI facility at the clinic in the next couple of months. If God is with us, probably even earlier.
God will always be with us. C'est ça qui m'a dit. Nous pas besoin de dépenser premièrement pour nous avoir les tickets qui pas trop bon c'est comme là nous connaissons les tickets d'avion était. Tu as besoin de payer un ticket d'avion pour nous aller dehors pour dépenser, il concerne l'accommodation, il concerne l'hôtel à cause simplement c'est Victoria Health Clinic, il y en a tout ça bonne facilité. Alors où qu'on a pour faire c'est pour un transport, soit pour un bus descendre, ou soit lever un petit téléphone. Mettez un appointment, un spécialiste là, bien sûr, avec l'équipe là-bas de Victoria Health Clinic, ou capable de faire. Et le docteur dit, yesterday, malgré le conseil public hier, nous avons réussi à faire un surgery et sa patient est très bien, merci. Jusqu'à aujourd'hui, bon matin, qui nous peut causer, nous avons réussi à faire un, bien sûr, c'est dans Zenou. Et Zenou, tout le temps, il y a un qui est important, si tout le temps nous peut aller à Zel, un peu de poids. Il met pression un petit peu les genoux, alors tout ça là, docteur, tout ça là, il y en a ici. Il y en a good news from yesterday's surgery, bien sûr, alors ça n'a pas hésitation, pas besoin de peur, pas besoin de quelque chose, docteur là, pour aider. Yes, there is consultation before we do the surgery.
Absolutely, there are many treatments which are available depending on the stage of the involvement of the joints, the stage of arthritis, as I told you. You can give the treatment. and it's going to be the one which is going to be the best around the world in terms of the staging and the medications and the final treatment.
Let's talk about, doctor, the level of surgeries. Sometimes it can be not that long, 1.5 hours. Let's talk about the level of surgeries.
So it all depends. Most important factor is the advancement of the disease. How bad is the joint, or if you're talking about the spine, how bad is that? If it is a single joint that you're doing, suppose a knee replacement, and the surgeon has a lot of experience with many years, and you have in today's time that you can actually save the X-ray onto your computer system, that gives you the level of bone to be shaved off, the level of bone to be removed. You have actually made a point. When you start with your surgery, because it is done under a tourniquet cuff, you do not lose any blood, and in that case you are able to finish the surgery faster. You are more systematic, methodical, and you get with the best results in terms of least possible bone being removed for the implants to get in. And on table itself, the patient is able to bend the knee easy. So that's the level of surgery which is required for the knee. As far as spine is concerned, a different condition. As I told you, that if it is this disc which has to be removed, if it is removed endoscopically, it does not take more than 1.5 hours.
1 hour, 1.5
yes,
hours.
yes. But if you are actually going in where the spine is shifted, there's scoliosis and everything, and you need to make the alignment correct, you need to put in some screws and everything. In that case, it takes a little longer. Yes, it takes around 2.5 to 3 hours. But again, in that case, because again you are incorporating the computer program with it, you are able to be absolutely safe without touching the nerves, without touching the spinal cord, and making the patient walk the next day morning. So the level of surgery and the advancement of surgery also depends on the surgical technique, the surgeon's know-how, and the technology that we are incorporating with the surgery.
And
all
the
these
gravity
things.
of the state in the state.
The gravity of the state is definitely a most important factor. How severe is the problem? How advanced is the problem? Like that.
Gravité, bien sûr, aux conditions, les temps, on arrive quand le docteur, bien sûr, ça aussi, il peut jouer un rôle pour que le docteur est capable de déterminer quand c'est le temps. Qualité surgery, à cause de ça, on peut causer un level of surgeries. Qualité surgery que vous prendre, quantité le temps, et tout ça, la docteur pour expliquer une consultation pour faire, pour expliquer ça, il peut tout dépendre de la gravité aux conditions, la santé, le temps, on arrive, docteur, là, il est trop tard, merci, pour prendre plus de temps, si on arrive à l'air, seulement, the solution is here at the Victoria Health Clinic. Dr. Gupta is here, and the team as well is here to help you better safe than sorry, s'il vous plaît. Leave téléphone, un petit call at Victoria Health Clinic, or maybe capable walk in, that can just walk in, book an appointment if you walk in today, it's that full, book an appointment for tomorrow, or ask to see Dr. Gupta if it's not busy. He can see how best he can help.
Absolutely. We are there for you guys.
Yes. Voilà, c'est ça. Pas hésiter pour Bercy, call à Victoria Health Clinic. Bercy nous connaît des 3 fois. Nous avons besoin d'un spécialiste ici. D'abord, tout Cécile. D'abord, tout Cécile, à actuel qui nous peut causer, on finit qu'on écoute Bercy. Il a ballot en étoile de temps en temps, parce que tous les mois, tous les jours, nous avons un spécialiste Bercy à côté Victoria Health Clinic. Et nous, d'abord, Cécile, nous accueillons les autres ici, Bercy, pour faire connaître Cécile, pour dire il y en a sa bonne option, il y en a facilité qu'il a à Victoria Health Clinic, il y en a. Pas souvent, nous besoin d'assister à une long waiting list, mais why not, comme si nous faisons ça pas là, nous allons bonheur, bien même nous guetter qui situation, nous les quoi, parce que c'est celle qu'on you never know qui est capable d'arriver avec ou les corps, un petit douleur, est capable that bad. Alors, s'il vous plaît, just report d'un spécialiste. Il a, nous pas besoin de faire une grande dépense. Oui, pour faire des dépenses, mais seulement dépenses pour la santé. Pas dépenses de rien du tout. Dépenses pour la santé, il concerne, si nous sommes capables, tout le monde dit, last time I said, if we can buy a car of, I don't know, 500,000 rupees, why not we spend 20,000 rupees on our body pour get comme si quoi qui marche. So, it's just like that. Because à la fin du jour, il nous les connaît pour besoin. Pour un cas avec tout le monde dit, pendant 15-20 minutes tous les jours, visiter un petit guide, nous les connaît, guetter. Il y a quelque chose qui parle là, parce que tous les jours, nous venons un jour prévieux, you never know. We are not getting any younger. Every day we're getting one day older.
Absolutely.
Yes.
But the more we exercise, the more we stay fit, we eat healthy, the body is something which rewards you. So it's going to keep you getting fitter by the time.
Our body challenges us. So why don't you challenge the body
Yes.
as well? As simple as that.
True.
More questions coming in.
Please.
Yes, docteur. Bonjour, Carole. Demande docteur combien coûte pour faire ça l'opération. Qui dit mouni a connaît quelquefois c'est 20 petits l'argent pour ça l'opération. Doctor, you don't understand Creole yet, no? Okay. He's asking about the price. Asking you how much will it cost for the surgeries. Now, it will depend on surgeries. If you're asking about the cost, it will depend on surgeries that the public will know how much, so that I can save a little to come and see you and pay. Maybe average, maybe.
We cannot give you an average because it usually depends on the stage, of the disease, the stage of the involvement, which typical implant, which sizes have to be put in, all that. So we cannot actually give you a particular price or a quotation to it, but definitely we can tell you that with our motto around the world, it is affordable, ethical healthcare for all. So we tend to provide all the benefits in terms of the patient, in terms of giving them a discount if possible, giving them a option of paying in 1 or 2 installments, so that they can actually get the best of healthcare, which not many hospitals or clinics or corporates allow us.
You can be flexible.
Yes, we are flexible with the payment thing, and it's not very costly. Even if these patients tend to go outside the country for their treatment, it's going to cost almost more than this, plus the travel, the stay, the agony of staying away from family, the family members worried how will they be doing there. So all that is being taken care of by bringing the surgery and the surgeons into the country. So I don't think so that we can compare the cost here and there, because there is a lot of difference.
Just a knock on the door. La Cécile pour Cécile, just a knock on the door. Tous affaires, il a avec nous, il a bakot Victoria Health Clinic, merci, en étoile, merci, n'a pas pour call pour des tickets d'avion, n'a pas pour call pour d'accommodation, participata pour mettre un deposit whatsoever. Alors, c'est just a knock at the door, il concerne ou la santé. Si vous êtes capable de payer 600 000 roupies, 700 000 roupies pour acheter transport, vous êtes capable de dépenser 40 000 roupies, avait dit, pour vous capable de gagner un coup, ou les corps, that's nothing like that. Il concerne ou les corps, tout le monde dit. Ça bonne affaire là, l'auto, l'argent, whatsoever. Nous pour quitter la terre ça. So, ou la santé aussi est plus nécessaire. I think that our health is the priority.
Paramount, yes.
Priority.
You can do anything
It's
in the
no cost
world.
to our health.
You can be running multiple businesses. You can be doing many works, social works, whatever. But at the end of the day, if your body is lagging behind, you will not be able to last long. So it's very important.
Un problème, ou capable travailler. Si pas travailler, ou so ta capable travailler pour gagner salaire, la faire 10 mois pour continuer une routine. Pareil, il nous dit, simple ça qui nous dit, faire visite avec les corps, aucune chose. You have to report. À cause, pas pour jouer coup, les jouer coup, un petit, aujourd'hui douleur, des maintenant, pas déjà, un petit douleur. Les vignes encore, les vignes, aggravé. L'aime là qui nous dit, in total, sometimes it can play with us, the pain. Today there's pain, tomorrow there's pain. Okay, it's just a little pain. Comes next week, the pain becomes more and more.
Yes, so if it is becoming like regular,
yes,
it was just a couple of days, improved, good. But coming every week, every 10 days, every 15 days, and there's something wrong internally, or with the postures and the work that we are doing, in the way we are doing. Another important factor I have seen here in terms of when we are seeing patients, why they get early arthritis or early age degeneration and wear and tear is a component of weight. When the weight is more, it definitely causes more effect on the hips and the knee joints.
The knee, yes.
So just make sure that you keep your exercise and everything in a way when you are able to get in a check. Try and make sure that you probably swim frequently, you do some exercises like walking or cycling, or
skipping
even little bit of jogging, or even gymming, whatever you want, to keep your weight under check, because that's very important in terms of a good bone health. If you're on one end, you are having calcium and everything, improving the bone strength. On the other end, if you gain weight, you need to increase the bone strength more to control that. So it's better that you control your weight, and that also gives life and years to your joints. The wear and tear is decreased, definitely.
C'est ça qui nous peut dire, on contrôle, bien si l'eau ou les corps, bien si on nous pas laisse nous venir trop gros, à cause de nous trop gros, bien si nous des pieds qui tiennent nous poids, en général, bien sûr, mettre la force, par exemple, dit pression, l'oser nous, bien sûr, dans humilier, ça qui nous dit nous humilier là, bien sûr, tout le temps, il vient un problème, nous un petit peu la graisse, pareil, nous dit, soyons pendant, dans le bon thème créole, pareil, nous dit, alors, sans nous, on contrôle, nous, la santé, l'exercice, il a clé. Très important, si vous full en forme, le corps, il y a bonne santé, just parfois 25-30 minutes, 25-30 minutes a day of exercise should be
enough.
okay.
6 days a week, good enough.
6 days a week, 1 day is for you, you can do anything, mais seulement faire si ou gagner l'exercice, s'il vous plaît, sur les corps. Bonne santé n'a pas quelque chose qui dit, pas capable de faire l'exercice du tout, là, ok. Mais si vous les corps bonne santé, si vous ne pas faire l'exercice, then that is a problem. You will gain weight, alors, ou les corps, il pas capable de tenir. It will be too big. Let's talk about the knee, doctor. How is spine surgery? How is spine surgery safe in surgery?
See, today we talked about, initially I just talked about the fact that
Sessions context today.
yes, so like we talked about the fact that we have brought in endoscopy. So when you're doing endoscopic surgery, the patient is awake and is able to see everything on the screen while we are doing it. So you cannot even touch the nerves, you cannot even go near the spinal cord. You're just removing the disc fragment which is out and you come out. In cases wherein we are doing open surgery, if we have to put in screws and implants, as I said that this bone is damaged and scoliosis, we need to put screws and bring it in place. In those cases, there are computerized neuromonitoring devices that we put inside with the catheters while we are doing the surgery. So whenever we touch a nerve, it just sort of buzzes. So when you are doing these surgeries under neuromonitoring, you know that you are not going to cause any damage or any touch on the nerve, and the patients can be absolutely normal compared to the earlier times. Even here we use a lot of magnification, so we use microscopes while we are operating near the nerves and the discs in the spine, so that again you are very precise and you are to the point and you are not touching anything which is not required to. So that is how the level of surgery across the world has increased in terms of the patient safety and getting the best of results. So that's there are a lot of myths. People say if you have been operated for spine, you can never have this, you can never have that, you will not be able to do this, you will have damage.
True?
And most people, when they come to us in the clinic, we tell them that this is required. They said, no doctor, I don't want to do it, I can end up with paralysis. I don't know where they hear this. They might have had some people who have had it in the previous times, but in today's times with the current trainings and everything which are available with the technology, with the amount of experience that the doctors get because of these surgeries being done very frequently, it is hardly something which we have seen as a complication of paralysis. So I don't think so. You need to sort of live in fear. I would recommend get out of your fear, meet the doctors, meet the specialists. It's not that we are the best. There are many people who are doing good work. Meet the doctor and treat the illness rather than being in fear because of what you have heard around the people saying this is not good, this is not good, because they don't know
what is the fear.
Yeah, and they don't know what is the next option. Suppose somebody has told you don't get your spine surgery done, but they don't tell you what to do. The patient is suffering, they are bed bound because of the pain. Their social life is gone. They cannot go out and meet people, they cannot travel, they cannot sit, they cannot stand. All those factors actually has a physical as well as mental effect on the patient, because they're not being social, they're not able to meet people, and they're living with pain.
Health.
Yes.
It's not good for mental health.
Absolutely not. Meet your doctors.
Yes. Arrête, écoute, ça qui nous peut dire, pas faire ça, pas faire ça, pas faire ça. Dans les mondes comme là, qui nous peut vivre là-dedans, dans ça, les mondes technologie, il y a une quantité de quelque chose à dehors, il y a différentes options, il y a un spécialiste pour tout ça, bonnes affaires. Avant l'air, ou décider de passer dans un petit coin, pour dire, moi, je ne vais faire aucune opération, moi, c'est pas ici, pas là-bas. Contacter un spécialiste ou des dimoun, bien si cause avec, et là, l'exemple est là devant nos ordi, côté Victoria Health Clinic, il y en a différents spécialistes, Dr. Gupta IN, pour spécialistes bonnes affaires les os, arthritis, il y en a différents spécialistes pour les autres maladies. Alors, ça va aller voir dans petit coin, ou écoute dimoun, soit appelé l'eau source, on va connaître internet, qui n'est pas vraiment crédible, qui dit, ok, mon papa fait aucun, t'as les magasins, ça, pas, Anna, sorti ça, bonne faux perception, because it's not true. There is someone, a specialist or a doctor that can help. Or better comme si pour rester là, dans petit coin scolaire, ou dit, à la fin du jour, pas pour masse du tout, là, nous pouvons faire quelque chose. Isn't it, doctor?
Absolutely.
Yes. We have more questions coming in. Morning, what is the diagnosis period for psoriatic arthritis. Am I saying
Yes.
the good one?
Yes. So psoriatic arthritis is something which is associated, it's again an autoimmune condition. It is associated with the skin lesions around the joints, and that leads to damage of the joints as well. Psoriatic arthritis constitutes less than 2% of arthritis in the total, I would say, the bucket of arthritis patients. And in most cases, if the treatment for psoriatic arthritis is treated early, started early, with topical applications of ointments and stuff, it is able to sort of control the condition. We rarely need to operate a joint which has been damaged by psoriatic arthritis, because most patients, because of the visibility of the lesions and everything, because in psoriatic arthritis the first thing to come is the skin lesions and then the arthritis. So you are able to diagnose it much earlier compared to the other conditions. So you start with the autoimmune drugs for the control of psoriasis. Once that is started, the arthritis is always under control.
Voilà la réponse pour question pour Kintex là bon matin par nous dit profitez merci pour demander d'autres questions, profitez pour avoir code Victoria Health Clinic là qui nous un spécialiste merci qui là code clinique aucun quelque chose qu'on a pour faire avec nous bon joint l'inflammation arthritis et ma petite quelque chose pour jouer avec aussi à cause de l'arthritis là t'as une lock pareil nous dit ou lock vrai alors ça fait si nous parle arrive jusqu'à ce dernier moment dernière situation, how is knee replacement safe, doctor?
Knee replacement is absolutely safe in today's time because you are doing it with a lot of technology along with you. So when you do it with a lot of technology, you know how much, before the surgery, you know what sizes of the implants are going to fit well. You know how much bone you have to remove, which is just the damaged bone compared to the earlier times when large chunks of bone were removed.
Were removed, yes.
So you just shave off the bones and you are able to get out of the surgical process very fast. And the second thing is, with the implants which are available in today's time, you are able to have very good results in terms of the patients being able to bend the knee fully, do all their activities. Even in about month and a half time, they can go into the sea, they can do their swimming, they can do their walking, cycling, everything is allowed. And with the type of implants that we have, the type of surgical processes with the precision, the patient is able to walk the next day. So we are planning to make the patient that we operated yesterday walk today. It's like that. So it is not a very, very long latent period between the surgery and you starting to walk. It is now immediate. That's the benefit of this surgery.
This is the benefit, la bénéfice pour capable faire l'opération. Pareil, nous dit un petit peu le bénéfice. Alors, ça pas hésiter sur les plus conseils ou les plus notions. Pareil, nous dit là-bas. This is un petit coup de Dr. Gupta, bien sûr, côté Victoria Health Clinic, ou soit des petits calls, si available, comme cause mais seulement, it's better to have a face-to-face talk instead
Absolutely.
of talking on the phone. Yes, absolutely.
True, absolutely.
Absolument. Gagner un tête-à-tête, par nous dit, avec un spécialiste, Dr. Gupta, là, de place où assise au téléphone, qui est capable de comprendre peut-être, docteur, il y a là, le temps face à face. Capable de montrer ou un petit peu par puis montrer nous là capable de causer capable de draw la table faire quelque chose ou capable de gagner un bon l'agrément les parties comme ça tout quelque chose il y a masse mais alors pas hésiter en nous arrête en la paix par nous dit stop being afraid when it comes to your body stop being afraid nous arrête en la paix autres dit un petit coup il a même là la porte par nous dit pas de besoin payer avion pas de besoin payer non rien pour faire plus que ça cause merci sous tu besoin dehors tu n'as pas option, mais la option est là devant nous la porte. Why not? Nous servir. More questions said. Okay, let me see. This one is in Creole. Carole, salam. Salam aussi. Il dit, bien sûr, telle opération, il y en a un petit coup qui vient avec. Très vrai, vraiment. Nous pouvons besoin, n'a pas quelque chose qui peut non rien comme il a dans le monde. Pas ici dans Cécile. Tout quelque chose où besoin payer un petit l'argent, il peut couper et il y a la porte. Et là, il y a la porte pour la plupart du monde ordinaire. Pas à cause de ça, mais seulement mais à cause du traitement, il y en a qui sont spécialisés ici, Cécile. That the person is saying that the treatment and the specialist, we are here, you are here in Seychelles now. Yes, it's expensive, but there are options here instead of going abroad.
Absolutely.
This
That's why
saying.
So
yes.
The world is moving towards reverse medical tourism now, wherein you bring the specialists, the speciality and the technology to the countries rather than taking the patients to other countries for treatment, because they always feel safer, back home, and you are able to cater to a larger population. Not everybody is able to fly out of the country for treatment, but when you are here in the country, you are able to treat a lot of people who need the treatment.
E ki pli go akor, kom si le tan ou isi se sel, ou pe fè tout sa ban zafè. Ou la vek ou famille, if everything goes well after the operation, your family is with you.
Yes.
After you have a checkup, you're still there with your family. You can go home, always go home and come back. Et c'est là ou la ba de pays di moun nou konnen. E pa fasil, sa ban zafè, nou tout nou konnen te di moun yale ki sa ban dilemme, ki zot passe là-bas, ben là, il y a la portée, traitement il a, docteur il a, l'opération il a, sometimes not at all. Will you need an operation? Il dépend de la gravité ou situation qui le docteur est capable voir, qui est capable d'assister. So, why not là, nous avons nous faire ding dong bell, là, c'est un petit quelque chose de nous joindre, arthritis, les os orthopédiques, d'une cause là, plusieurs reprises, servi, ce petit moment là, sa semaine qui nous peut causer là, Dr. Gupta est là, Victoria Health Clinic, il ouvert tous les jours, mais il y a cause de public qui peut travailler. So, c'est une massive opération hier that was successful and the patient is okay.
Ready to walk?
Walk? Pe masse déjà. Voilà. Alors, ça n'a pas rien pour payer. On nous tire ça la paix, s'il vous plaît. On nous arrête écoute 10 moun. Ça va 10 moun nous pas connaître si vous vraiment bon docteur, si vous vraiment bon spécialiste. Ça cause 10 moun qui là. They have studied for these things. So why not you consult them like is là, bien sûr. And doctor, before we conclude our conversation, I will leave the last message, key messages, like last time, with you for the public of Seychelles.
So, important things: eat healthy, exercise daily, take care of your joints, your postures, the way you sit, the way you work, and most importantly, make sure that if you are suffering from any condition, you or your family members take the opinion of a specialist in terms of treating it the right way, with the right, as you said, the right dose, the right time, and the right way, so that it's not something wherein you have a very, very aggressive and advanced condition by the time you land up with a specialist and directly requiring a surgical process. In most cases, if it is diagnosed early, treated well, it does not advance to the stage of a surgical process. But if it is required, now we have all these services in Seychelles and we can cater to you. As far as our things are concerned, as I discussed last time, we talked about doing computer navigation surgeries. We have started it. We talked about MRI. We're going to come with it in the next couple of months, and we're going to start as soon as the MRI starts. We're going to start off with oncology, which is cancer treatment in Seychelles itself, so the patients don't need to travel a lot for routine cancer treatments. So even that would be available in the country. So we are trying to bring in all these for the benefit of the Seychelles population here. So let's see how things go by, but I'm pretty hopeful of getting good results with all these patients who have been suffering for years, have been traveling many places, and even on the government side, they have been trying their best, but the population is too huge for a single center to handle at the government level. So that's the reason why the patients usually are waiting with their conditions, and they are actually on the waiting list and everything. Even for MRI, they have to wait months.
Months and months.
Yeah,
There's
so
a
we are
long
trying to.
waiting list.
Yeah, so we are trying to bring in as soon as possible. You can help the government in. I mean, if the patients are treated and diagnosed early, obviously the treatment will start early. That's the whole basic condition.
Voilà. Bonne nouvelle, bien sûr, from Victoria Health Clinic, c'est bien sûr qui MRI très bientôt, in a couple of days or a couple of months, we don't know. Bien sûr, il peut arriver quand Victoria Health Clinic, nous tient pression, bien sûr, le ministère de la Santé, le bon droit, ou capable d'aller bientôt côté Victoria Health Clinic, en cette fois pour gagner MRI, mais seulement là, il y en a tant les autres quelque chose qui déjà là, quand Victoria Health Clinic, ou capable, bien sûr, gagner un petit peu plus connaissance pour aller voir, bien sûr, l'opération, on peut gagner fait, tient pression aussi pour aller à l'étranger, pour aller avec l'État, bien sûr, pas pour gagner sens, pour aller faire bonnes affaires, pour n'a pas quelque chose à cause, pour le moment, quasi cancer, qui peut gagner faire abroad, un petit peu l'état, mais seulement avec le temps, c'est celle, il faut bien équiper avec tout ça, bon quelque chose qui nous pas besoin de dépenser ça à l'argent, ou à service à l'argent, ou à faire les autres quelque chose, mais pour ça qui m'a dit, le Dr. Gupta, il a, pour Victoria Health Clinic, bien sûr, tous les jours, donne un petit call for appointment or just walk in and ask for Dr. Gupta or other specialists Autre quelque chose aussi ou capable de demander à cause aujourd'hui nous peut causer un petit peu pour qu'un texte qui demande qui topic ou fait faire ouvert ou TV bonjour pour topic nous type cause une conversation qui nous type continuer qui over last time bien sûr cause arthritis bien sûr avec quelque chose orthopédique qui nous type cause un petit peu là genou un petit peu bien sûr avec spine que nous type continuer qui nous type commencer le faire pour qu'une call merci pour contribution et bien sûr I don't know doctor before we conclude I just want to ask I don't know if you can give this person maybe an advice, but I don't know if it's concern our topic of today, but I would just say it. It is in Creole. She's asking about hernia.
Oh, wow.
Yes.
So, if she's talking about a simple hernia, which is usually called
Simple
as
hernia, but when he does the hernia operation, surgery, the belly gets bigger. Is it? I don't know if you can help.
It could be a hernia, and fortunately, we have the surgeon also currently here.
We have a surgeon.
Yes, he can come over. The patient can come over. We can be seen, and we can see how best we can treat the patient, because we are again in the field of surgery. We are doing pretty advanced surgeries here. We have started doing laser treatment for hemorrhoids, laser treatment for piles, laser treatment for varicose veins. Then we have started doing these hernia things and everything laparoscopically and treating a lot of conditions with a minimally invasive surgery. So, I mean that's not in my paradigm, but yes, I am a surgeon, so
but
I know that this is being treated and he's been doing well on these patients. So, if they want, they can come over today, tomorrow, whenever they want, and we can take care of her the best way.
Naomi,
not everything requires surgery. It might be some treatments.
Good news, Naomi. They can do it at the Victoria Health Clinic. Pas vraiment spécialité docteur, mais il y en a les autres spécialistes là, comme Victoria Health Clinic, qui sont capables de donner un petit check. Là, descend nous dit bon matin ou soit demain. Sautez un petit coup avant, it's that too late. It's better safe than sorry, s'il vous plaît. Descendre bonnet, alors, pas besoin d'hésiter, pas besoin de peur. Il y en a spécialistes comme Victoria Health Clinic. C'est ce qu'on a pour faire, lève un téléphone, call pour appointment, soit walk-in, ou soit aux autres pages. Bien sûr, regardez, et bon spécialistes, il y en a lots of specialists available. They are coming in and everything. Madame Daniela, il fait ainsi, qui de temps en temps, il y a un spécialiste, merci, pour résoudre, pour soulager un petit peu bon problème qui nous, nous peut gagner. Alors, voilà, sans qu'il y ait besoin de déplacer pour faire une grande dépense. It's at your door, just a call away from Victoria Health Clinic, merci. And the doctors available, the specialists available, they will help you. Si vous avez un petit sous les côtés, that's it. They can be flexible as well. You never know. So why not? Give them a call. Dr. Gupta, thank you so much for joining me
thank you,
today,
Carol, for
this
having
morning.
me.
Yes, we meet again. I hope to see you more on my show. I don't know, maybe next year. But
sure, absolutely.
Yeah, absolutely. But let me wish you a Merry Christmas.
Same to you, the whole of Seychelles. Merry Christmas and a Happy New Year. Enjoy with moderation of alcohol.
Moderation,
and
Dr. C.
Take care of yourself and stay fit, stay healthy, physically, mentally and socially. Thank you.
Voilà, merci docteur. Joyeux Noël, l'année prochaine. You understand what I say? Merry Christmas, we meet again next year.
Thank you.
Voilà. Modération, hein, pas dire qu'à cause d'un petit green light avec un petit verre d'alcool. Modération, s'il vous plaît, à cause de nos viewers tout à partir l'année prochaine. Oui, nous avons un petit guide, mais seulement pas besoin. Don't go over the board. Hein? Faire beaucoup modération. Et bien, si c'est le Dr. Gupta qui tient moi aujourd'hui, que Victoria Health Clinic, pas hésiter pour donner un petit call, soit walk-in, soit à l'autre autres pages. Bien, si nous continuons sa conversation qui nous tient commencer. Et voilà. Mais, hopefully, next year, nous avons Dr. Gupta pour l'autre quelque chose encore, ou les autres spécialistes aussi, qui est Victoria Health Clinic. C'est aussi ça qui nous